In a normal vaccine schedule, the first dose is given at 12 to 15 months and the second at 4 to 6 years old. Well, doctors' offices have been inundated with phone calls from concerned parents since news of the measles in Arkansas broke yesterday. Pediatricians, of course, recommend the MMR vaccine, and they're working to make it more available to those who need it.
Channel 7's Kayla Christian spoke with a pediatrician today to find out what parents need to know. She joins us now live in Little Rock with that story. Kayla.
Yeah, Chris, Beth, according to the Central Arkansas Pediatric Clinic, parents are flocking to doctors' offices and pharmacies just like this one, many with small children, wanting to make sure that they're protected.
This is a very contagious virus. It's one of the most contagious viruses that we know about.
The measles, once declared eliminated in the U.S., is making a comeback in states across the country. Arkansas now has 2 confirmed cases, and public health officials say these outbreaks are due in part to declining vaccination rates.
We have all been sort of planning for this, but now is sort of go time and making sure that we are really being aggressive in keeping the children in Arkansas healthy.
Dr. Megan Rep is a pediatrician in Saline County and is also vice president of the Arkansas chapter of the American Academy of Pediatrics. She says the measles, mumps, and rubella vaccine, or MMR, is recommended in 2 doses, offering 97% immunity.
To make sure that your child is updated on their measles, mumps, and rubella vaccine. The first one is usually given between about 12 to 15 months of age, and the second one is usually given between the ages of 4 to 6 years old.
Babies and young children are most at risk, and doctors' offices across the state are making changes to ensure they're protected.
The vaccine is approved for babies who are 6 months and up, so those who are 6 months and up who have not yet had an MMR vaccine are eligible now that there's an outbreak to receive that vaccine. If it has been greater than 28 days since your last vaccine and you've only had 1 dose, you are eligible to go ahead and get your second dose, even if you're under the age of 4.
As physicians continue to treat their patients, they say they're also bracing for what could be ahead.
I would love to see it stop right here, but I would think that that's fairly unlikely at this point. With as contagious as this disease is, and with as many states that are expecting big outbreaks, I think that it is very likely we're going to see a lot more cases from here.
Now, if you or your child is not up to date on vaccines or you're not sure, you're encouraged to contact your doctors or the Arkansas Department of Health to make sure that you get the correct dosing. On your side, I'm Kayla Christian.
Okay, Kayla, thanks very much. And keep in mind, a person becomes contagious 4 days before they first start showing the symptoms of measles. They remain contagious for 4 days after those symptoms begin. Well, the arrival of measles here in Arkansas is a developing story.
We'll, of course, have any updates right here on air and online at katv.com.